with Cities for Better Health, since actually it was Cities Changing Diabetes, with two organizations. So I'm with Drexel University College of Medicine, and I'm also with the House of Faith called Dare to Imagine. Our project at Dare to Imagine is with the Faith and Diabetes Collaborative, where we have small community groups called I-groups, and we do weekly sessions for 8 weeks, about 2 to 3 times a year, called Dare to Beat Diabetes, where we have up to about 20 people join this group for 8 weeks, and we discuss issues around health education, for diabetes awareness, diabetes prevention, and actually diabetes management. Cities for Better Health has enabled us to serve our community by just giving support. It is a great opportunity to collaborate with other organizations, other houses of faith, really coming together to promote health and wellness in our communities. The best part is actually achieving that goal by meeting with community members and helping them on their health and wellness journey. And they actually are having a good time. They respond and they're learning and they're being educated about themselves, about their health, and actually making changes in their health for healthier living, better outcomes in their own health, and actually better outcomes hopefully in the community's health. So we're really excited. I'm excited to be a part of this organization and partnering with them to really help people on their health and wellness journey.
I work as a social worker at the Jewish Relief Agency, a nonprofit agency based in hunger relief that was founded around 24 years ago. 60% of our clients are Jewish, but we serve clients of all faith traditions and backgrounds. We are serving clients food boxes, a 15-pound box of kosher food every month. And we believe that, nutrition is healthcare. So the more nutritious food we can provide to families, they can buy more nutritious food with the money that they're saving by us providing them with a box. We also offer other supplemental programs in our organization. We offer a family-friendly food bag for families with children under the age of 18. We also offer a 10-pound produce box to those same families in the summer months. If they're not receiving the school lunches, the reduced cost school lunches, and we can provide them with more nutritious access to food for children in low-income communities, we'll do that during the summer months for them when we have access to that. So I love partnering and finding more connection with other community agencies and networks. I think it's important for agencies to collaborate with one another. I feel like the more you know, the better you can serve your community. Cities for Better Health has taught a lot to JRA about having healthcare and nutrition be coincide and be one, and we're very appreciative for all they have to offer us.
I come from a place called Bharatiya Temple and Cultural Center. We got the collaboration with Cities for Better Health this year, and what we're doing with Cities for Better Health is called holistic health through a Hindu way of life and dealing with diabetes control, and through food, yoga, meditation program. We've been doing certain activities that is related to offering health information and health-related benefits to our community, which includes health awareness seminars, blood drives, vaccination drives throughout the last 10 plus years. What this grant does is it opens up a lot more avenues for us to engage the community and bring more benefits, health-related benefits, to our community and the local community. What we were able to do with this grant is really bring in some of the experts that might cost some money, that financial support to bring in a little bit more experienced and experts in the field. We've been doing a lot of different activities run by volunteers pretty much. And what this Cities for Better Health grant provides us is more opportunity to bring in experts where it might cost us money, and also offer some of these tools to manage their health for people that could not afford in terms of diabetes, the providing the kits or testing and little exercise devices, and also providing health-related information that they can utilize on a day-to-day basis. And also we organized some of these events where we really enhanced our offerings through this grant.
So I work for St. Christopher's Foundation for Children. The program that's being funded by Cities for Better Health is called My Family Kitchen, and it's an in-school cooking program for fifth graders, fourth and fifth graders. So we're in 16 schools, and we have, in each class there's about 5 to 6 students and 2 adult volunteers. The children do everything. They prep a meal, they cook it, they sit down, they set the table, sit down and eat, and they clean up. We run 2 terms, one in the fall, one in the spring, 8 weeks each. So My Family Kitchen has been going on for a long time, since 2010. It's only been in our foundation since 2020. But up until we got the funding from Cities for Better Health, the volunteers did all the shopping. Now, we would give them a card and they would do the shopping, but that I thought was a big burden, especially if you were trying to get a more diverse volunteer pool, if you wanted to get students or people who didn't have a car. And we were able to partner with another community-based organization to shop and pack the meal kits for us, and then with a second one, Food Connect, to do the delivery. So Food Connect picks up the kits and delivers them to the schools. And then when the volunteers come, they just have to unpack and start prepping.
So the Food Trust's City for Better Health project is oriented around working with the men and women in a Philadelphia prison. We provide nutrition education, we help the halfway houses and the prison look at their food, provide feedback to help improve what's available. We work with the prison orchard, where incarcerated men and women help grow food, and we help to distribute it to the community. We work with workforce development to provide both information on healthy eating, but also on ServSafe certification and connections to jobs. So Cities for Better Health funds, amazingly, us to do what we think is such critical work and that really nobody else is doing. Cities for Better Health has been absolutely amazing because it listens to what our participants and our communities tell us they need. We develop the programs that meet the needs consistently. Cities for Better Health says, if that's what your participants are telling you they want and they need, we're here to support you. And that is really very unique. And then they have these opportunities for us to collaborate with other groups. At the meeting today, I met up with somebody who I hadn't worked with for years. So every meeting I go to, I find another collaborative partner. We can't do that much on our own, but when we connect with somebody else, we really feel like we can, with the support of Cities for Better Health, stretch ourselves, expand, and become more of a comprehensive approach.
So I am from Greener Partners. We are a food education nonprofit primarily based in Philadelphia, and with Cities for Better Health, our main project is our Belmont Healthy Schools project. So our Belmont Healthy Schools project has 3 main components: food education programs, so making sure people know how our food starts out as a seed and how it gets to our plates and all the processes in between of growing and harvesting and then cooking it into a delicious recipe. Free food distributions. Once, students get to learn about healthy fruits and vegetables, also allowing them to go home with fruits and vegetables. And then third component, school gardens. So having spaces to learn about how food grows and where it comes from. The best part about Cities for Better Health is knowing that we're part of a coalition of people that are all working towards improving health and nutrition and all working towards a similar goal. I think it's really great to be connected with these other wonderful organizations that are doing similar work in the city and to have connections that we can reach out to when we need more support. It's just great to have this network to work together.
So I work with Philabundance. We're the accredited food bank in the Philadelphia region. We serve 9 counties 5 in southeastern PA and 4 in southern New Jersey. We're collaborating with Cities for Better Health to focus on several North Philadelphia neighborhoods that we've identified as high-risk neighborhoods that we want to work more with in terms of getting nutrition and nutrition education. So those neighborhoods are Hartramp, Strawberry Mansion, Brewery Town, and Sharswood, providing meals and after-school snacks to youth programs in those neighborhoods, engaging in communities, community activities, listening sessions, hearing about the challenges, the successes in these communities, the activities that are going on to bring communities together, and also inviting youth, elementary, middle age, high school even, to come to our community kitchen, Philabundance Community Kitchen. They're learning what it's like to be in the professional world, and they're learning what it's like to work in the culinary world. We're, I would say, a large nonprofit. It's a little bit harder for us to get granular and hit the ground and talk to people in our communities that we serve. That's something that I think has been the biggest surprise and benefit of working with Cities for Better Health. All of the opportunities that we're getting to work with the other co-grantee partners here and see the work that they're doing, but also to work with some of our partners on a closer, more intimate scale. Going out, getting out into their community, attending their community events, talking with them, having conversations, sitting back, having a cup of coffee and listening. It's something that we don't often get the opportunity to do, and this grant has just opened that door for us in a pretty big way.
The Cities for Better Health project that we're doing is our Youth Land Stewardship program. It's a 10-week internship for local high schoolers. They're basically paid to be a farmhand as well as go through our curriculum, and they get to learn all about urban agriculture, food justice, culinary skills, and a lot of other professional development skills that they are interested in. They're growing the food. We donate all the food, but they get to take home whatever they want as well. So throughout the program, they're also able to learn more about cooking with the food that they grow and take it home to their families. In addition to being able to support students financially, we're also able to provide a space for them to learn more about their interests, also be in community with each other, learn more about urban agriculture, which is a really important part of food justice. And we hope that the students that walk away from this experience will be able to connect urban agriculture and food justice and be able to enhance their own communities after going through our experience and our program that we've created.